Hi everyone, welcome back. So today we're returning to the provider branch of the tree. This time we're talking about professionals and workers, otherwise known as the healthcare workforce. Professionals and other workers who provide the services that help people stay healthy and get well. Today we're joined by Dr. Karen Donelan. She is a senior scientist at the Mongan Institute for Health Policy at Mass General Hospital and an assistant professor at Harvard Medical School and an expert on the U.S. healthcare workforce.
Hello, my name is Karen Donelan, and I'm here to talk to you today about health policy issues affecting the U.S. healthcare workforce. I'm really happy to be here at the School of Public Health, where I trained and was educated, and very grateful to Dr. McDonough for inviting me to do this session today. Health research, as I do it, is a team sport, and I come from some wonderful collaborative teams. You're going to hear more about some of the work I've done with these folks today, but I want to acknowledge my colleagues at the Mongan Institute for Health Policy, colleagues at MGH and Harvard Medical School, and finally at the Vanderbilt Center for Interdisciplinary Health Workforce Studies. And I'll talk to you about my colleagues there as I go forward. We're going to cover several topics today, including a sort of general overview of major policy issues affecting the workforce. We're going to talk about characteristics of various health professional workforces, really important issues of supply and demand, which are coming to a head now with health reform and an aging population. Talk about care coordination in increasingly complex healthcare teams, relationships among professionals and professional codes of ethics. And finally, we're going to hear a little bit about the intersection of public attitudes about health professionals and professional attitudes about their own careers and the future of those professions. So in this first segment, we're going to really give you an overview of several key issues. Affordable Care Act, the importance of states in determining health workforce policy, why health professionals are key in driving healthcare costs, and finally we're going to talk about some of the sources of data that I've used to prepare this talk and to help you read more if you have an interest in this issue. So first of all, I'm sure you've been hearing a lot about the Affordable Care Act in this course, and the Affordable Care Act had a lot to say about health workforce policy. I think first and foremost, what I want to highlight for you is there was a key portion of this which has really not been implemented. The policy was supposed to create a National Health Workforce Commission. That commission was named, but the commission was never funded. And still here, a few years later, we still don't have funding for that commission. It's not meeting. And it was supposed to play a really critical role in coordinating the efforts to understand these issues of supply and demand and education and training for health professionals. So we feel its absence. Secondly, and importantly, the Act expands the National Health Service Corps through scholarships and loan repayment programs. This is a series of efforts to try to bring people into the health professions, especially in areas where we have underserved populations in this country or where we have health professional shortages. The job creation was a really key part of this part of the Affordable Care Act, anticipating the demand for services from newly insured folks. And then you'll hear a little more about the state power to recruit and license people, but this act also acknowledged the power of states in recruitment and training. Finally, I think I'd like to highlight the real bolus of money to community health centers that happens through this act. Again, recognizing that a lot of newly insured people will come from places where there's traditional lack of access, and we're trying to expand access for people who don't have it. So let's talk a little bit about the states again here. So understanding that at the beginning and end of the day, states license and register health professionals. They define what they can and cannot do and what kind of education and training they need in order to be registered. There are a number of additional professional organizations that do this as well, but you can't work in a state without being licensed and registered there. So key role for states there. Key role for states in determining scope of practice of health professionals, and we'll talk more about that today too. Traditional conflicts between primary care doctors and specialist physicians, between nurses and physicians, trying to figure out who's allowed to do what procedure, who's allowed to order what test, who's allowed to prescribe medications, all have been contentious issues in state policy and continue to be so. Finally, the states have a key role in disciplining professionals. So if there is malpractice or other professional conduct issues, the states step in there. And again, that puts them in a tough position and a powerful position to regulate the professional behavior of health professionals. So I think that the next big issue that gives health professionals both a lot of power and a lot of political heat is their role in driving healthcare costs. And you're seeing a slide now that looks at the distribution of health expenditures in this country along the lines of sort of several large categories of expenditure. But part of what you have to realize is that what we're paying health professionals is really just a small piece of that pie. A lot of what's in that pie are costs that are driven by health professionals: medications, tests, office visits, hospitalizations, and health professionals have a lot of power to drive the expenditures of the system. And so that puts them in the target of regulators and of policymakers whenever there's a need to control healthcare costs, as we're seeing right now in the current setting. So always keep an eye, as I say, not just on what we're paying people, but on how they're providing services in a way that will drive expenditure. The data, if you're trying to figure out who all these folks are and where they work and how we register them and how we pay them, three big sources of data for most of what I'm going to talk to you about today. One are these state boards of registration and licensing of health professionals. The second is the U.S. Department of Health and Human Services, Health Resources and Services Administration. You'll hear people call that HRSA. They have a Center for Workforce Analysis. That center is in transition, so that makes this an interesting time with the commission not meeting and that center with some leadership transition. Finally, the U.S. Department of Labor and the Bureau of Labor Statistics give us most of the data in the U.S. on employment by industry, and you'll see a lot of data that I've gathered from those folks. So really important to look at all these different ways of studying health workforce, and we'll hear more about those sources today. So that's a brief overview of the major health policy issues facing the U.S. health workforce today.